Welcome everybody. Dr. John here with Orlando Alternative Health, and today I just kind of wanted to share my thoughts on some observations I've made in clinic recently, and a topic that may seem very simple, but I find it to be a much more complex issue. So what I'd like to speak about today is pain. Pain is something that I very often treat with acupuncture, electroacupuncture, dry needling, and various other manual techniques. I feel I am very familiar with pain and have seen many patients with various pain presentations. So I want to backtrack a little bit and discuss my personal experience with pain. I was raised from a very young age on many different types of holistic therapies and have lived a very active lifestyle. Growing up, I played various sports, suffered various injuries, so of course I experienced pain during them, the injuries. However, it was never something that I feel like greatly defined my life or I really understood, because I always had a lot of different options for treatment and very highly skilled practitioners that I would see if I had an injury. I had a great chiropractor that I went to, an acupuncturist, massage therapist, incorporated different dietary and lifestyle changes if I needed to, and things tended to work out. So fast forward into adulthood, and the way that I pretty much found myself into this field as a licensed acupuncture physician is I was working in another field, and the abridged version of this story, the shorter version. So one day I got a call at work, and my mother was in the ICU, and she was comatose, and she had stage 4 terminal cancer. And over about a year, I had to make all of the medical decisions myself regarding her care and the way we were going to handle it. And the time when she was in the emergency department, they were advising me after she got transferred to the ICU to pretty much, she was only 65, to pretty much not even have the surgery to potentially allow her to live a little bit longer. Fortunately, I did not listen to the doctors, and I listened to my friends who helped coach me to a good decision. We had the surgery, and I took care of her for about a year. And in that time, we were in the hospital, we had multiple doctor's visits, and one constant that I noticed at every appointment, the paperwork that we filled out, or when the nurse would come into the room, or we'd go in for imaging such as an x-ray or MRI, the one constant was we were always asked, where is your pain, how is your pain, what is your pain? And it was it was so frequent that it became an ongoing joke between my mother and myself. And even though all of the standard diagnostic tools, between the surgery that she had, the MRIs, and everything else pointed to her having widespread cancer that had spread throughout her body, and she only had a very short period to live, there was no pain. She was, I guess, somewhat an anomaly in the system, in that she did generally eat pretty well. She went to the nutritionist regularly, had regular chiropractic, moderate exercise, and I guess because of that, she had no pain. And it was kind of, I think, mind-baffling that somebody in her condition would feel that way. So that experience, I want to say, kind of was my introduction to this widespread, I don't want to say phenomenon, but there is unfortunately a large amount of the population that, unless you are in a medical environment seeing patients regularly, you are probably not aware that a large percentage of the population is in regular pain. They experience it on a daily basis. It may be something debilitating. And when I say pain, I'm going to elaborate on that a little bit. So we could be speaking of somebody that suffers of constant migraines. They're debilitating, they're likely very misunderstood, and there is a psycho-emotional aspect to that. Through that, there may be a spouse who doubts that they actually have this experience and are unable to work or unable to do very simple activities. Chronic back pain. Just recently, over the last few weeks, I had a patient who is fairly young. He's just in his mid-20s and has had excruciating hip pain, and multiple surgeries have been delayed because of issues with insurance. And because of that, this individual has just the quality of life, and it is somewhat compromised. And that's something that I feel like is highly misunderstood about pain. So pain is not just, hey, I want to feel good. For those that are suffering from very long-term, intense pain, it can cause you to suffer sleep disturbances, maybe not be able to sleep at all. So what does that do? That then affects our energy. It affects us emotionally. It affects us in our relationships. It affects us on our jobs. It can very much affect us in our finances, as the ability to be able to work, the ability to think clearly and make good financial decisions, the ability to do something as simple as cook your own meals, do your dishes. All those things can be impacted by your pain. And for those out there who are watching this and can relate to this, you know what I'm talking about. And that, besides the point that you're always in this pain, there is probably a level of lack of understanding and doubt that is cast from family members, associates, co-workers, that I doubt that there is any intent and negativity, but it definitely, from my experience talking to patients, can be a burden and just an additional layer into this complex pattern of pain and the way it is impacting your life and taking you away from the things that you want to be doing. So this is why getting your pain under control, restoring the function of joints, muscles, ligaments, fascia is so important. And I'm just going to touch on that very shortly, that many patients also have told me that they tried acupuncture, they tried chiropractic, they tried massage therapy, they tried a shaman, many different things they've tried. And they might get some results, they might get none. And they don't know where to turn. And that is another issue that that can present a challenge, is you don't want to just go to endless appointments without any hope or knowing that you're going to feel better. And in reality, there's never a guarantee. Everybody responds differently to medical treatments. However, I have found some of the very specialized techniques that I have done advanced trainings in can very often provide patients with significantly better results than they may have achieved from another practitioner. And so without getting into that too much, the point of today's video pretty much is just to talk about pain, talk about how pain is not just a matter of not feeling good. There are so many other complex layers to it that for those suffering chronic pain and the toll that it can take on their life, it can really be overwhelming. A sense of hopelessness sometimes will be felt, and what I want to say is there is hope out there, that finding the right treatments, finding the right person, and like I said, acupuncture, maybe you went to somebody and maybe they just weren't the right fit for you. So that's why it's important to talk, do a consultation with patients, establish the goals, see what everybody's looking for, make sure that the practitioner and the patient are on the same page, and and then results. Results are important. And if you're not getting results or just minimal results, sometimes a combination works really well. I've worked with several massage therapists that are phenomenal massage therapists that I've had great results personally with. But let's say we can combine advanced acupuncture or dry needling techniques with massage therapy and just really take it to a whole new level of feeling good and really exponentially increasing the efficacy of the treatment. So meaning the treatment will hold better for you, will feel better, and likely last longer. So anyway, I do not want to make this video super long. Hope you've enjoyed this today. It is a subject that I feel like is highly misunderstood in the general population because people with pain tend to just kind of bury it inside and not really share it, and they don't want to burden others with their pain. And then there are those that maybe have not experienced a lot of pain and just have a lack of understanding, and that's okay. I'm happy for you that you have not experienced it, but just be aware, there are a lot of people out there that you may not know. It's a daily grind and struggle for them just to get out of bed, just for them to be able to do the simplest tasks, and for them to get to another place in their life where they can get back to how it used to be and feeling good. That can just have such a trickle-down effect into so many different aspects of your life. And that is the important thing that I want you to take out of this. So feel free to leave me some comments, follow, subscribe, be very thankful for that. And can also check me out. I'm on Instagram as Orlando Alternative Health. My website is also Orlando Alternative Health. If you are in Orlando, feel free to shoot me a message. I'd love to set up a consultation, see how we could help you, and let me know your thoughts. Again, my name is Dr. John with Orlando Alternative Health, licensed acupuncture physician. Thank you for tuning in today, and have a great day.